But just so you know a little bit about the Special Education Task Force, this was started in the Capital District quite along in 2004 is when I joined. And the idea was to get all of the stakeholders who are involved in special education together in the same room to talk about the issues that affect students with disabilities, with the goal of improving outcomes for students with disabilities and promoting communication between parents and school staff and providers and advocates who support students. And I think that's really what makes the task force unique. It's not geared to one particular stakeholder group. It's really to facilitate communication among all stakeholders. So we have 6 active regional task forces right now. There's more information. I'll put the website in the chat about those, and each of the regional task forces holds events. In the past, the New York State Special Education Task Force has offered an annual conference. That conference has been virtual for the last few years. And this year we decided to do something different, which is this series of lunch and learns instead of that annual conference. So this is the first of our series for 2024. I got confirmation today, just to let you know that, and I'll put information in the chat, but the next topic, which will be on February 14th at the same time, is going to be on restraints and timeout rooms and how they affect students with disabilities. Some of you may know that there were very serious and positive changes to the law that happened this past fall. And so we're going to be launching a new guide on that. And I believe it'll be myself and Tara Moffett, who represents many, many school districts across the state, will be providing those updates to folks. So more information will go out about that and registration. But given our limited time and the huge interest in this topic of assistive technology, I'm going to move forward in that direction and just briefly introduce our speakers, which include Tina Caswell, who is a longtime practitioner and currently the director for clinical education and at Binghamton University. In my private practice, private to DRNY, had the pleasure of working with Tina, and she really provides a wealth of knowledge on high tech and low tech AT that's available to students. We have Reva Reed with us. Reva has her own practice, Reva Reed Therapy Services, and she too has been practicing a long time and doing a lot of direct work with students and other age groups. And then we have Lucas Stone, who is with the Technology Related Assistance for Individuals with Disabilities, which is known as TRADE. Many of you know that. TRADE is now operated out of the Justice Center, but they provide a lot of information, training, and actual equipment to people of all ages, including students, and Lucas will be sharing more about that. And last but certainly not least, we have Christina Asby, who's my colleague here at DRNY. Christy is the director of several of our programs here, including our program for assistive technology. And so she will be kind of weighing in from a legal perspective on the rights and procedures for requesting assistive technology and issues related to school and IEPs and AT. So with that introduction, I am going to turn it over to Tina Caswell and to get us started and to just kind of talk, what is AT, Tina?
Thanks, Julie. I appreciate the introduction, and I'm glad to be here today. I'm going to actually share a PowerPoint and just kind of give some definitions. If you can't see the PowerPoint, please let me know, and I will. Can you see it yet, or just my desktop? Probably you can't see it yet. Can you see it? No. Yes, you can.
We can see it.
Perfect. Thank you very much. So just talking about what assistive technology is, it's really just looking at how do we provide some kind of maybe some kind of material or strategy that we can help with reading and dressing and communicating and playing. So really the goal is that any item, piece of equipment or product that's either commercially off the shelf, modified, customized, is to help to maintain and improve functional capabilities of individuals with disabilities. So with assistive technology, I know Reva's going to talk about it from her lens as an occupational therapist, and I'm going to talk about it from my lens of being a speech language pathologist for going on 32 years now. So my area of expertise is AAC, or augmentative and alternative communication, and really looking at how do we support communication for an individual who's maybe nonverbal, low verbal, or is not intelligible in terms of their speech production, and how do we use language and how do we use assistive technology, AAC being one of that, under that umbrella, to improve communication. So we're really looking at what tools do we have that support individuals. And I'm going to kind of go run down what some of those tools are in the interest of time. And I'm hoping we have some time at the end as well. As Julie said, I am the Director of Clinical Education at Binghamton University. We actually have a full clinic, and we have a referral form that we can send you as well. And we are welcoming our graduate students in the fall of 2024. And so we're going to have a full on-campus evaluation where we do AAC evaluations. So just to kind of put that out there as well. So how do we support individuals in terms of communication? One thing that people think about of terms of AAC is that totally supplementing speech, like someone who's completely nonverbal. But what I'd like to share is that we use AAC to support unintelligible speech for individuals with autism that maybe have some speech, but their speech may not be voluntary. They may say something they didn't intend to say. And there's a great body of research that really shares and supports, and I did share this with Julie, and she can share it with everyone, that we can use AAC with individuals that are actually verbal to help support executive functioning skills, problem solving, to be able to communicate more effectively. And I've shared some research on that area, and it's something that's really important to consider, that AAC is not for just nonverbal individuals. Childhood apraxia of speech, I'm actually doing a research project on this right now in terms of what do we use AAC for. We can use it with children with speech disorders or motor speech planning as well. So we don't have to think of it for just our kids who are nonverbal. Also for language and literacy acquisition and language and literacy development, again, the research starts to show us start right when that child is a baby. Start building communication early on with a lot of different supports. And I put a link in this, and I can also share these slides as well, to something that really speaks to this idea of using AAC beyond just someone who might be nonverbal or non-speaking. So some AAC strategies we might include is thinking of multimodal communication. So right now I'm using my hands, I'm using my eyes, my face, my gestures. That's multimodal communication. I'm really using alternative strategies to really emphasize how I'm communicating and how I'm sharing my message. That's really no tech. So if you think of just people in general, just human beings in general, we do this all the time. And that's a strategy that we can think about of the individuals that we work with or our loved ones, that they're really using what we call no tech to communicate. Low tech might be communication books or boards, pen and paper. And mid-tech might be a voice output device with some single messages like the Big Mac. I use a lot of this in literacy development for shared book reading. And then speech generating devices where we have our high-end tablets with speech generating software on them, or dedicated systems for an individual for communication. This is a big question. How do we get these things purchased? And I think this is going to be talked about a little bit more as well. Speech language pathologists are the only ones that can write a letter of justification for an AAC device. So you need a speech language pathologist to write the report to get the communication system. It's really important to get a full AAC evaluation and to look at including all team members, parents as key partners in that evaluation. I have been a huge advocate for parents. Anybody who knows me in the room knows that. I really support parents and advocating the team and parents coming together and supporting an AAC system so it doesn't get abandoned and kind of like put up on a shelf somewhere. So how do we purchase this system and who's responsible for that? Again, I've shared some links with Julie that shows kind of this process. Also, please feel free to reach out to me as well. And I think that you'll all have our emails at the end of this presentation. Another question that came up from some of the participants today is dyslexia and dysgraphia assistive technology. And really work with your school districts or whoever is working with the child or the individual that you work with is think about what's out there today, audiobooks, using word prediction on our phones or our iPads, screen readers are right on our phones. There's a lot of different ways to support reading and writing in our school districts. And so keep that in mind. Again, I sent Julie, Julie, you do have this, right? I keep saying that. I sent like a whole fact list that you can share with everybody later. I think that's kind of my time. That's kind of like just a quick part of it. And I'm going to toss it, I think, to Reva Reed.
That's fine. And thank you, Tina. We will be providing that list to everyone. We might be providing it through a link to reach out to that list as opposed to making it available. Depends if I can work something out or not.
Let me know and throw my email on there too. So if people want to get in touch with me, they absolutely can.
Okay. Thanks a lot, Tina. Yep.
Sure.
Great.
All right, Reva.
Hi, everybody. My name is Reva. I'm a special education teacher, an occupational therapist, and a teacher of the visually impaired. I've been providing assistive technology to students for a very long time. And the bottom line that I want to just share is that assistive technology is mandated to be considered on every student's IEP. I go to many IEP meetings where the consideration consists of one sentence that says, oh, this child doesn't need assistive technology, and that's the end of it. I think that is not really in keeping with the spirit of the regulation. So what happens is some kids get referred for an AT eval. There are no guidelines about what does that eval look like and who should be performing that eval. I work with a lot of different school districts and everybody seems to have their own AT eval. Sometimes it's one person, sometimes it's a team of people, and sometimes they just send students out for someone else to do the evaluation. That's if an assessment actually happens. You know, sometimes people have a particular device or something that they like, and that's what kids get assigned. You know, we use Proloquo, or we all use whatever. Not exactly ideal. Ideally, we should have a well-trained team of people performing an evaluation, an assessment. And the research bears that out, of course. It's not rocket surgery that, you know, the more people, the more brains, the more eyeballs that are collaborating, the better the outcomes. Devices that are purchased with a team approach are more likely to be used and less likely to sit in a closet and have nobody attending to them. Assistive technology has a lot of great research supporting the importance of the devices. Kids with high frequency disabilities like dyslexia and dysgraphia and attention deficit have a much higher graduation rate, have a much higher college admission and better job placements post-graduation when they have the when they are afforded assistive technology. But who gets assistive technology? I'll tell you who. It's people who have those parents. You know the parents, I mean. You know, the parents who have dragged our system along for the last 100 years. You know, the parents who said, no, my kid is going to school and you're going to provide my child an education. And guess what? You're going to have to follow the law. And it's through parents and the disability rights folks of New York who are then ensuring that school districts are providing. What research says is that for kids with vision impairments, for those kids who need AT, between 50 and 70% of those kids do not actually get the devices they need. We're not doing a great job with this. So AT could use a lot of work. One of the pieces that I really want to present to people today is the idea that there is a huge disability that we're missing in so many kids. So the biggest cause of vision impairment in the United States today is a brain-based vision impairment. Research indicates that 70% of kids with CP, 38% of kids with Down syndrome, and research is a little more muddy on kids with multiple disabilities, but I've seen research in the 70 to 90% range have a cortical vision impairment. Those are huge numbers. And for many, many kids, they're not getting appropriate interventions. So we're providing assistive technology for kids, often based on vision, for kids who cannot interpret visual information. Very recent research from Perkins School for the Blind and CVI Scotland indicate that 1 in 30 children has a brain-based vision impairment. I'm going to say that number again. 1 in 30 children. That means that brain-based vision impairments are more common than autism spectrum disorder. It's shocking, just shocking. So I'm just going to give a really quick synopsis of what might a child with a brain-based vision impairment look like. These are kids who don't use central vision very well. They're more comfortable using their peripheral vision. These are kids who don't have good eye contact. These are kids who do not like novelty, they like sameness. These are kids who don't do well with eye-hand coordination. Their eyes and their hands don't work well together. They often have lower visual field deficits, so they don't move well through space, don't walk downstairs well. They don't do well with visual imitation. They are incredibly attentive to movement, light, and color. So these are kids who cannot suppress the need to look at things as they move by them. So these are kids who look like they have ADHD, or look like they have autism, or look like they have a significant intellectual disability, or worse. They look like they're not interested, like they're not attending, and that they're not understanding. So I would say that kids need to be considered for vision intervention as part of every assistive technology assessment. Okay, done.
Thank you, Reva. That was a quick end there. Very helpful and kind of shocking information. I think I know people are kind of anxious to learn a little bit about how do we get assistive technology for our kids, but before we go there, I think it would be helpful to just kind of get some examples of real equipment and real students. And so I'm wondering if Tina, Lucas, Reva, you could maybe share some of that information about what's out there. And Lucas, maybe use this as an opportunity to talk a little bit about trade.
All
All
right.
right. Sorry. I'm trying to set up my camera. So, I'm actually in the sensory room here at the Trade Center. My name is Lucas Stone. Trade stands for Technology Related Assistance for Individuals with Disabilities. So New York State, every single county in New York State is covered by a trade center. So I have 5 counties. Wherever you're located in New York State, you'll be covered by a trade center. So trade, what we do is basically you like to think of us as a library. All these like assistive technology devices that you guys heard about, we are available for for all ages, but I'm going to focus on the student-based, a lot of the student-based things that I have in the loan closet that might be more pertinent to what we're talking about. So what she was talking about, like some of the mid-tech, low-tech, mid-tech, high-tech communication devices. So we'll go with a mid-tech, something like the AbleNet Quick Talker. That's like a mid-tech device that is available to loan through the loan closet through your trade center. Now, every trade center is going to have a different inventory, so you got to call them and see what they have in stock. What we do is a 60-day loan on most of our tech equipment. Sometimes we get stuff donated here through trade, and we can actually donate it out to the families based on what we have and the needs. So something like this, I have this, that's like a mid-tech for a communication device. Then of course we have the iPads, high tech. So I believe all the trade centers got a nice grant loan to purchase a lot of these just a couple years ago, and we got some really nice. I got the iPad Pros. They're all loaded with Prolo Quo to Go and TD Snap. There's actually a couple other programs that if a provider, a speech therapist, or a parent comes to me and asks me, hey, do you have this or do you have that? And I might not have it in the loan closet, but based on what our needs are and the community's needs are, that is something I might be able to purchase for the loan closet. So I'm always taking feedback from you guys and the teachers and the parents and the therapists about what to purchase for the loan closet. So I'm always on the lookout for new stuff to get. So like these are all available for a 60-day loan. So the trade center it's almost more like a stopgap in between you writing the script for the student to get the device, and maybe the lag time, or you want to try out the device before you go ahead and purchase it. That's what we're here for. You can borrow it, try it out in the schools, make sure that it fits their needs. Because you don't want to buy a $1,000 tablet that, as you guys said, is just going to sit there. But to try it out in the schools, at home, anywhere. So anybody in the counties, anybody in New York is available for this service to borrow. There's no insurance needed, no doctor's notes, we don't need a script from the occupational therapist or anything like that. You just have to give us a call and ask to see if it's available. I brought out a couple other devices that are pretty common with the students, like a gait trainer. We get a lot of funding specifically through early intervention, so 0 through 3. So the little guys, we have a lot of stuff specifically for them, but we also have stuff for the older kids. Seating options for kids in the class. I hope you guys can see this okay. So this is like a special tomato on a mobile base. I had someone borrow this just the other day. Like a conveyed stroller. Kids with that need a lot of support. Older kids that need a lot of support that aren't in a stroller, but they're not in a wheelchair. So kind of the mid-range stuff. So a lot of this stuff I have available. We like to think of it as a library kind of ideal situation. The trade center, I'm kind of like the librarian loaning out equipment. I'm not here to teach you how to read, but I can make suggestions on what you want to read and what things we have in the loan closet. So yes, most of the equipment is a 60-day loan. It's due back after the 60 days. someone, if like the person, the parent can pick up the equipment, the therapist can pick up the equipment. They just do have to sign the liability, and that they will, the agreement that the equipment will come back. Requirements, I went over the requirements for the trade center. So we have all sorts of devices. This is just a very small, I'm in our sensory room right now. We actually have a sensory room here for kids, free of charge. All you got to do is call me and make an appointment. They can come in and use the sensory room. A lot of kids come in here, autism spectrum, sensory issues. They enjoy the room. We have a speaker in here. We have a ball pit. We have panels on the wall. So yeah, that's like I said, that's for the 5 counties I work with. This is, I know I have the luxury of having a big loan closet here and a lot of space. So confer with your local trade center to see what they provide based on where you're located. I do have adaptive toys and switches, mobility aids, seating, other seating positioning items, other communication devices. That's just the couple I brought in here. We have the Ubisoft Duolingo device, which is really cool. I didn't bring that in, but if you ever have any questions, just call your trade center and see what they have in store. We do take donations. A lot of the stuff that gets donated, your kid grows up, we donate it here, and then I can give it out. That's stuff I can give out to the next person, next kid who needs it, that doesn't have the funds, can't get the script written. We do demonstrations. If you need a piece of equipment demonstrated when you come in, like how's this work, you can come in and I can demonstrate it for you. I can do on the spot demonstrations if you need me to come to a school or a meeting or anything for me to demonstrate what we do or how the program works. Here. Talked about our sensory room. So yeah, basically that's it. I just want to let you know, the trade program is for everyone in the community. It's not just for students. It's for older folks. It's for really young kids. It's for students, for anyone in the community. So anyone can call your trade center and get a piece of equipment that you're looking for. We have wheelchairs, other stuff that's not really specific to the students. So I wanted to focus on this equipment here.
Thank
so
you.
Yeah.
Thank you, Lucas. That's really helpful, and it's good to actually put eyeballs on some of this technology. Also, while it's a 60-day limit on the loan, the fact that this is equipment that could be life-changing, and so you want to pick exactly the right one, the fact that you could get a loan and try something out, see if it works, that's really, really helpful. And we don't always get those opportunities. So just quickly before I go to Christy, Tina or Riva, I don't know if you wanted to just share something really exciting that you think people should know about in augmentative communication or in supporting people with visual impairments. I will leave it to you to decide.
Riva, would you like to talk visual impairments, or I can share some latest technology? I'll share some latest technology. Wait for Riva. What we are able to secure is if you have an individual that you are working with that's severely motor impaired, there are devices now that take just a very slight movement of a head, finger, wrist, elbow that can operate a communication device. So if you're working with and your child has a severe movement impairment, there are devices. So don't let people tell you there's not, because they can't operate a communication system. We have eye gaze. We have small movements. We have one individual that's using literally his cheek muscle to operate a communication system, just one cheek. And he's able to use his communication system, and it's opening up his world. It's a company called Control Bionics, and they are some of the latest technology. They've been in business for about 3 years. And so I guess that the biggest thing is do not hesitate to do an AAC evaluation. Just do it, because you really have no idea until you get in the room and you get people in there what's available. My best advice is look for a qualified speech language pathologist, master's licensed in everything. And Lucas, thank you for having the loan library, which is amazing. But if you have a licensed speech pathologist working with you, you can also get a six week to 8 week trial with a device with a speech language pathologist who's going to be by your side through that process. So there's some different ways to do a trial with devices. So that's some of the big stuff. It's called the NeuroNode, and it's really, really exciting. So that's kind of my big news, and it's opening worlds for some of the kids I work with.
Thank you, Tina. That's great to know that there's trials available. Reva?
I am using, I'm working with a couple of kids with those NeuroNodes. So cool. So cool. The big thing for me is that I'm going to go back to that whole brain-based vision thing, which is that most communication systems are used or are based on the research on children with autism for whom visual functioning is a relative strength. So they are often totally inappropriate for kids with brain-based vision impairments. And be very careful for companies who are offering pre-packaged CVI-friendly communication systems. They need to be individualized. So that's, just be careful.
I'm going to back Reva up
That's
on
it.
that. Do an evaluation, because you really need a team of specialists to do an evaluation for AC, CVI. It's really critical. I guess I can't say that enough. Do a full AC evaluation. Just getting a tablet with an app is not an evaluation. You really need qualified folks. And I was reading some of the questions. I was just going to answer one real quick about parents being on an IEP. Parents should be on an IEP and part of the process, but I think Christy probably can share more how that can happen.
Right, which is a perfect segue into having Christy talk to us a little bit about the regulations and strategies for securing AT evaluations and AT equipment in an IEP. So I'm going to let you get started on that, Christy.
Hi, everyone. I'm simultaneously doing the spotlighting. So if I pause for a second, it's only because I have to switch over the ASL interpreter. So bear with us here. Hi, I'm Christy Asby. I'm an attorney at Disability Rights New York, as Julie mentioned. And for almost a decade now, I've been working with students to help them get assistive technology in their schools and in the community and at home if they have medical needs, and as well as all of those places where a student never has to be without a device that's necessary in their normal settings. As Tina and Reva mentioned, the importance of an AT evaluation, it cannot be understated. AT evaluations are not only the jumping point to identifying a need and supporting and identifying whether or not you have a legal right to a device, but they also allow families and students and school staff an opportunity to explore what's out there, because sometimes an individual, as a student, may go into an evaluation on one track thinking that they need X device, and then after a thorough evaluation, they actually need a Y device, to something different. Maybe it's a slight difference, but differences nonetheless. The assistive technology evaluation should be offered really at the first opportunity that a student is receiving their triennial evaluations or even their initial evaluation for special ed services. So when you're going in to meet with the school team, whether it's early, whether it's when they're in pre-K and they're very young and you're exploring those specialized needs, or if they're, perhaps in high school and they're having issues and they're the school is exploring what may need to be implemented for the students so that they can meet their educational employment goal. AT should be discussed. It's not only should it be discussed, it should also be a line item on or multiple line items on an IEP document, as well as the related services that are necessary to use the devices that are put on the IEP. As Riva mentioned, sometimes these devices get put on an IEP, they get ordered, they somehow make their way into the school, and then there are no services that are connected with the device. And so the school is not appropriately implementing, or the school doesn't even know the first steps and how to get the device turned on and get the student to use the device. So it's really crucial that when a school and when a CSE team is contemplating what devices are necessary and when they're looking at the AT evaluations, that services are added. And I think that Tina and Riva mentioned it quite nicely. When you have an AAC device, such as a speech generating device, whether it's dedicated or whether it's on an iPad through an app, the analysis of what is needed doesn't end there. It has to constantly be, it's something in motion, because communication is something that's ever developing and changing. So you can't just upload a few words onto a speech generating app and then call it a year. That doesn't meet the child's communication needs. You have to have speech language pathologist assistants. You have to have dedicated time for working with the families to upload new languages, new words, new images, restructuring the formatting of the devices based on the students' needs. All of these things are not stagnant. They do require a lot of additional services, and the school, in order to sort of get the most for what you put in your IEP, in the student's IEP, you really need to have these ongoing services. If you could just bear with me, I'm going to switch over. Okay, Bethany is not on, so I'll continue. All right. So within the evaluation, you want to make sure that, any data is gathered that can be helpful in identifying what the student's strengths and weaknesses are. And this is really something that, I have seen a lot of data being collected through the speech generating device process, like the request process. But it's not just SGDs, it's also, OT related devices, and it is devices for hold on, bear with me. I'm sorry, guys. It's devices for therapies like, muscle strength therapies. It can be devices for writing. It can be for maybe older students. It could be devices on a laptop that help manage executive functioning skills. And data is really important to gather because that shows that there is a demonstrated need. And from a legal perspective, you want to be able to show that as a student or a parent. And this, for the school's purposes, collecting this information, trying different systems for students, putting that time into the AT evaluation process is really important, because you want to make sure that the student's set up with something that works. Otherwise, everybody's just wasting their time. And also they're not, arguably the school is not meeting their requirements under FAPE. That's sort of the worst case scenario for a school, because then there'll be issues that they have to backtrack. And that wouldn't be a good thing. Now, I want to talk briefly about the difference between the devices that are reviewed and considered for really strictly for educational to meet educational goals versus the devices that are needed for medical needs and communication needs and developmental needs, and therapeutic needs, because schools have so much involvement in a student's need, and it's not just how they read and write and what kind of test results they can get with the assistance of AT, but we're also talking about developing the lifelong skills that these students need to have, so that they can go into their to their next phase of life, growing up, becoming an adult, if they have employment goals and living independently, thinking about at an early age what devices are necessary to develop in a way that helps the students meet these lifelong goals is really critical, and AT can be such an important component of that. And that's really where the school has to, it's best if, the school is willing to work with the parents, and then the parents are also bringing in their doctors and the other treating practitioners that are working with the student. And that's when you see a lot of collaboration and a lot of thoughtful and constructive conversations about funding sources, because schools are required. If a device is on the IEP, whether it's for purely educational purposes or for developmental and medical purposes, the school has the ultimate legal responsibility to provide the device. However, in most cases, schools are not going to cover the cost of a student's wheelchair. Perhaps a student needs a $50,000 a group 3 motorized wheelchair with various features on it. And it's somewhere identified as the student having that device in the IEP and using that device, and maybe there's goals and specifically related to OT or PT that work with that that wheelchair device. The parents and the school and the parents and the school and the student and the practitioners, they were all work together to make sure that the wheelchair is covered through through medical insurance, so that the school is not responsible for covering this very personal medical device. And that's where looking to Medicaid or private insurance and making sure that coverage requirements are met is really critical. And a lot of the burden is put on the parents for this, because that's just the way our system is set up. And there are other non-school related legal procedures if the device is denied, and the school is sometimes put in a position where they identified the device on the IEP and then the device is denied, and then it's really important for the school to work closely with the parents to make sure that that device is approved. Otherwise, the school will be trying to meet goals that they will not be able to meet because they have AT on that is not currently in the possession of the student. So from that regard, I think that schools should be very open and practitioners should be very willing to support a student in getting their device that's necessary for their developmental and their medical needs. And also it's important that a student has a device, whether it's an AAC device or like a purely medical, what seems to be a purely medical device. It's important that the students have these devices available in all settings. That's like, bringing it back to where I was the beginning of when I started talking. It's really it's best for the student to be able to have these devices in their community, if they go to church, if they, when they're in the stores, when they go to get therapies, when they're hanging out with their friends outside of school. Having the devices available to them that they need in order to maintain their relationships and develop in an as age appropriate way as possible. That's really important. And so to the extent that schools understand that, it's a good thing, because then it makes it easier for the schools and it makes it easier for transition periods as well, from what I've seen. I also want to, I want, there's a lot of things you can talk about from the legal perspective with AT. I'm trying to hit on sort of the realistic highlights. Right now, on the Department of Ed's website, they do have some information available that I think would be helpful for parents and schools to revisit if you've seen it before or visit it for the first time. And I think that, going into a situation where if you're a parent, for example, and you want to communicate with the school, taking in as much information as possible from the state website, and of course DRNY has some information available, and then also exploring what kind of devices are out there with Lucas or any one of his colleagues in the other of the 12 trade centers throughout the state is a really useful way to sort of be prepared and be well-rounded in a conversation to get everybody on the same page as fast as possible. Because the reality, as I mentioned earlier, the reality of AT is that there's a lot out there, and it takes some time and some effort on everybody's part to really understand what would best serve the student who's being evaluated. I want to give a bit an anecdote for everybody as I sort of wrap up my time here in the brief conversation that we've had about the legal aspects. We have been at Disability Rights New York, several attorneys, and this is not exclusive to DRNY. Other attorneys in the disability rights field have been working on these issues as well, of assistive technology and reasonable accommodations in higher education. And I know we're talking, you're thinking, why is this relevant in this conversation here? Well, when a student has a goal, an educational goal that would require higher education, and really this, think high, like becoming a doctor or some sort of specialist in the medical field, or becoming a legal profession, becoming a lawyer or in the legal profession, or getting a master's degree or getting a PhD. There are these tracks and that people can see themselves in if they have the right tools that they need to get through the higher education system. In order to have a really strong legal position to obtain a reasonable accommodation in that higher education setting, it is absolutely essential that the conversations start when the student is a child. It is important that parents and that schools and treating practitioners can work together to explore whether or not a student has a disability, what their disability may be, whether or not there is some assistive technology or some sort of intervention that can be helpful for the student at an early age, or whether or not the student and the parents should be aware of the issue and work with the schools through the years, but maybe they don't need anything at that very moment. However, we have been seeing in our office a trend in the higher education setting of denying highly qualified individuals to become licensed in whatever they want to do, be denied the ability to get reasonable accommodations through that licensure program, or the testing requirements, or in the legal field, the bar examination, in the medical field, the step exams and the medical exams that are required with that. And we are seeing rejections from these licensure organizations for reasonable accommodations on the basis of the fact that the student did not get reasonable accommodations or did not use specific AT in high school. And it is very frustrating for the student, of course, and for their legal advocate, as their legal advocate, to say your history doesn't demonstrate that you have had this need, and that is the reason why they're denying it. And legally, it's a bit of uncharted territory, because the history of a person's disability is really important to demonstrate a present need. So, I want to end my brief speech here today about that, to really stress the importance of assistive technology as early as possible, even if it is not in the context of an IEP, even if it's parents working with practitioners to, get something in place. Because as a child grows up and becomes, a high school student and then into college, it is very important to have that record to help them throughout their adult life. So that's all I have for now.
Thanks, Christy. I appreciate that. And there's a lot to cover here. I did put the policy, the link to policy and information about assistive technology from the State Education Department in the chat. But one thing I just wanted to comment on, and I hope it's okay that I'm jumping in, but I think one thing we heard in preparing for this presentation was the frustration that it's hard to get an AT evaluation, and that the quality of the AT evaluations sometimes leave something to be desired, and sometimes just simply because schools might not have someone who's qualified, or, well, actually, I'll speak to that in a minute, but who may be familiar with the range of devices that are out there, what's new, what's current. I mean, school folks are really, really very busy these days, including the related service providers. So the OT, the speech, whatever, are giving a lot of direct services, and then to be on top of technology and whatnot is pretty difficult. And so one thing that I thought was really interesting in that policy mandate was it talked about that there really is no specific qualification for a person conducting an AT evaluation, which I think by now everyone on this call should be like, really? But that's actually the truth. But nevertheless, the policy director is also pretty clear that the CSE should be talking about this together, and thoughtfully considering the skill sets required to conduct an appropriate assistive technology evaluation. And I think that's where a conversation can happen between parents and providers and school folks is what are the areas, broad areas of need someone may have, and then who is going to have the qualifications to evaluate that, including being aware of all of the things that are available. But I just thought I would throw that to Riva and Tina a little bit. If you had suggestions on what qualifications schools and parents should be looking for when conducting an assistive technology evaluation.
So, yeah, I actually just put something in the chat. It's called the SET framework, and it's a certain framework to be able to utilize to do an AC evaluation or an AT evaluation. So thinking of like a CSE chairperson, knowing that they're coming in, is there should be a plan in place for the whole team to be able to review the child and build a profile. And I think that's really lost about building a profile about the child with everyone at the table, and then determining who's going to do which part of that assistive technology evaluation, being a speech generating device or some other system for reading and writing, whatever it may be. If that qualified person is not at the table, then I really think we need to honor the parents to find that outside evaluator to be able to do the evaluation. To Christy's point, Christy, the adult point, I will share a brief anecdote about that. I worked with a child who used a speech generating device, an AC device, because her speech was highly unintelligible. When she went to college, they wouldn't let her use it. It's a whole long story. She's now graduated with her master's degree. And she has cerebral palsy, but she really wasn't understood. So to start really young, but back to the CSE chair, I think it's up to the CSE chair people to pull their team together and really build a framework of who's going to do what and be very strategic and make a plan. And I feel like when I go to meetings and I go in as a consultant, there's been no plan made, but it's not of the fault of the people at the table. And it's not the CSE chairperson's fault either. It's nobody's fault. No one's thinking about it. So when I go in and I sit down with the team and I go, here's what we need to do. Let's make a plan. And people take a big, deep breath like, okay, someone's got a plan. And then everyone feels better because someone has a plan. So that's kind of my viewpoint, is have a plan. So I did put the SET framework in there, which is something I often use and teach my students. So Riva?
I like the Wisconsin, the WADI, the Wisconsin Assistive Technology Initiative. It's a 60-page document, and it goes through the whole evaluation process and takes people through step by step. How do you do an observation? Who should be there? Like, it's just like a really nice framework about looking at the big picture of an assistive technology assessment.
Great,
think,
thank
you know,
you. Thank you for sharing that.
Yeah.
I'll just throw in my lawyer hat too and say that as Christy mentioned, it really is a good idea to request an assistive tech eval if there's any indication. And for most students will benefit from AT. Whether it's absolutely necessary for them to meet their goals, that's for the CSE just to decide. But at an initial evaluation, schools are required to evaluate all areas of suspected disability. And under the definitions of assistive technology in our regulations, it speaks to the evaluation and the device and the training as all being part of an evaluation of a student for their initial evaluation. So for folks who haven't made referrals or do make referrals through their own practice, that's something to think about, is that at the time of initial evaluation, requesting an assistive tech eval, and then at the triennial as well. And that's the evaluation that has to happen at least every 3 years to determine if a student still qualifies for special ed, but also to get an updated and more in-depth sense of their present levels of performance and needs. So that also is another really appropriate time to ask for an assistive tech evaluation. And a while back, you might be able to have the right to an independent assistive technology evaluation at district expense if you were unhappy with the AT evaluation that the school conducted. That's a little more fuzzy now in light of recent case law from the Second Circuit Court of Appeals. But to the extent an AT evaluation is part of that initial or triennial evaluation, I think that there is a good sound basis to request an independent evaluation if that isn't, if it doesn't meet sort of like the minimal standards, it wasn't committed by a qualified person for whatever reason. But before going that route, I think these ideas of sitting down as a committee and really talking about this is the most important way to head off these communication and formal disagreements and whatnot.
Yeah.
So with,
Oh, sorry, Julie,
Yeah.
just one thing to add to that is, yeah, it's true. The independent evaluation for AT is kind of under, may or may not be under question. What isn't under question is the fact that a student has a right to get what's medically necessary for them under the Medicaid, like if they are on Medicaid, then they can get early and periodic screening and treatment. EPSDT. What? Okay, I
Yeah.
never remember the acronym. What the words are to make this acronym, but it's basically a catch-all for what a practitioner, what a medical practitioner has evaluated as a medical need for development, for treatment, for therapies, then that is something that's covered under Medicaid. It's required to be covered under Medicaid. And because of that, the school has to take it seriously. And you can argue outside of the IDEA, you can argue under ADA, the Americans with Disabilities Act, and 504 for that. Also, not to, and which I already mentioned, sort of what the Medicaid requirements are set forth by the Department of Health, the State Department of Health. So to the extent that there is something that parents and practitioners want to explore that could be identified as part of the EPSDT requirements, that's an excellent way to have that conversation, to require the school to have more accountability than just pushing you off and saying, oh, well, we're not doing an independent evaluation for you.
thanks, Christy. I'm going to just start going through these questions in sort of the order that they've been.
Can I just make one comment?
Oh, sure.
I just wanted to say that I think anytime at an IEP meeting that it's reported that a student is not performing to what we think is their abilities, I think that should automatically generate an AT assessment. And I think you should never say a child should benefit from an AT assessment. Need.
Takes a team.
Thank you for sharing that and that tip as well, Reva. All right, so I'm just going to go in kind of order here. So who and what evaluation can be asked for to determine if a child has brain-based VI? I think that's for you, Reva. You're muted. There you go.
Am I unmuted? All right.
Yep.
There you go.
Tell me it again. I'm sorry.
Who and what evaluation who and what kind of evaluation should you ask for to determine if a child has brain-based VI? Like who would diagnose that?
That's a great question. Typically it would be an ophthalmologist or a neuro-ophthalmologist. I have a a pediatric orthopedist who works with a lot of CP kids who is diagnosing CVI. I would ask for a screening by a teacher of the visually impaired, specifically somebody who is certified in CVI.
Thank you. So that was a couple people asked that question. How can we find individuals to provide a good quality AT evaluation in your area?
I think that's $1 million question. It's hard. It's hard. I think a lot of it's word of mouth to find, depending on where you're from, right? I mean, maybe New York City, if you're from there, it's going to be easier, but I think it's word of mouth to try to find who can do the evaluation. I don't know if that's an easy answer. I mean, I can obviously promote Binghamton University again and say, hey, we're going to do AAC evaluations, and we're kind of new to the gig, but I don't know anybody else in Broome County besides my colleague Reba that's doing assistive technology evaluations. That's something that lends to, should we start developing a listserv in our areas of who's qualified so parents have a listserv to go to? That would be amazing, right? Throughout New York State, so that question can be answered. Who feels qualified to do an AT evaluation? I think it would be great to have available for parents.
That is a great suggestion. Lucas, does trade maintain a list of people who can conduct evaluations? Do you know?
No, but that's a great idea.
Okay.
I'm happy to help you with that initiative, Julie, because I think it's something that's really, I get asked a lot about who can do AC evaluations in like Poughkeepsie. There is Zoom too. We can do things via Zoom for telepractice and things like that. There's some ways to do it. So if you need some help problem solving that, happy to do that.
All right, that does sound like it would be something incredibly useful. Okay, next question. Unless anybody has other ideas that they want to weigh in on identifying people to do AT evals. I know, Christy, you do work with, because you work with all ages of people. I think a lot of times it is a medical professional that is either instigating, either endorsing or making a referral, yes, to certain individuals. So is consulting your medical professional or pediatrician a good way to think about that as well?
Yeah, I mean, quite frankly, that's where I would start, because again, any way you can get assistive technology more zoned as a medical or developmental need, you're going to have more legal rights attached to that than if you're just strictly talking about in school during certain time periods where only certain people have the skill set to use that AT. You're really, you know, the broader you can get to sort of like meeting a developmental or medical need is, you know, that would be a goal that when I'm working with parents, and schools, you know, that's what I'm really focused on, in order to get the most, you know, to have the most robust conversation and the outcome be like quick and efficient, and the student can get what they need immediately. And again, like looking at this less within the confines of the school and like looking at the community-based needs is, you know, really important. And so to the extent that your medical providing the team providing your child or the student with their medical treatment, that's really, to me, the best place to start. And if you're really stuck, contacting a vendor who's in the business of selling the devices to see, you know, who they're working with these days.
Thank you, Christy. The next question just asks if there's a place that parents can learn more about different types of AT that could help their child. And there is a wealth of resources for that, and both Tina and Reba and Trade also has information on that. So we do have sort of a resource sheet that I'm just trying to get set up as a Dropbox so I can make it available to everyone. And if I can't give you a link during this event, we will certainly be providing a link afterwards that has that list of resources. In addition to that, we are recording this and anticipate that this will be posted and available, because there's a lot of people, because of the weather yesterday, had power outages and couldn't participate, or just couldn't because of the time of day. So we will be making all of that available on the task force website. Nancy, maybe you could type that into the chat, but that's where it will ultimately land. We also have actually it will land on the Special Ed Task Force YouTube channel, which is where all our videos are. And there's a whole library of videos and sessions on topics related to special education. So I would encourage you to look for that. Okay, so next things, are there speech therapists who concentrate specifically in assistive technology?
I can answer that. Yes, there are. There's some people that actually have specialized in the area of AAC or assistive technology, but not everyone does and has. We have what's called the big nines. We have lots of areas in speech pathology that we focus on. So there definitely are people that really learn about the latest technology that's available. So you just really have to ask who really knows the information. So.
Great, thank you. Next question, how often can an AT evaluation be requested?
I can say for AAC, it should be done every 6 months or every year, because communication changes consistently. So it has to be done. I think that either Reva or Christy said it earlier, just can't say it's one and done, because language continues to develop. So AT and AAC evaluation should be done consistently throughout the year. We do, with my teams, we do quarterlies. Every 3 months, we meet and we talk about where the child is at the point of their communication system.
Thanks, Tina. I'm wondering, I get that, like once a student's been identified, it's important to keep evaluating. I'm wondering if this question though isn't geared towards how often can I request an AT evaluation from my school district? I think that's probably what the answer is. Do you want to take that, Christy? Do you want?
Yeah, I mean, I think we kind of covered it already, where Julie, you were talking about the initial eval and then the triannual evals. So definitely make sure that AT is being revisited in all of those evals that the comprehensive evals the school is performing. But again, as a parent working with the medical providers, quite frankly, you can do evaluations in that scope anytime there's an apparent need for anything developmental or medical related. I mean, quite frankly, kids are outgrowing wheelchairs on a regular basis. SGD needs change substantially. Therapy devices like bicycles and tricycles, they're consistently developing. So it's just really important to stay up on what the latest technology is, because if there's something that has suddenly come available on the market, there's probably a need for an evaluation for it.
Yeah, thanks, Christy. And just for initial clarity, because I don't want to mislead anyone either. The reason that you ask at an initial or a triennial evaluation is because that does provide more of a procedural posture to request an independent evaluation if you disagree with the school's evaluation. However, a parent can request an evaluation of any kind at any time. I would make a request in writing for a CSE meeting and then talk about what your concerns are. And the CSE will talk about whether an evaluation is indicated and who should complete that evaluation. And this isn't something that's like an extra either. I feel like parents should recognize that assistive technology, the IDEA and state law recognize assistive technology the same as they recognize speech therapy and OT and PT and counseling. It's all a service that supports a child and that a child can benefit from. So you really can ask anytime for an AT evaluation. It's just the ability to challenge that evaluation if for some reason it's not adequate is probably going to lie more when it's the initial or the triennial evaluation. All right. Next question. I just answered that. It was whether can a parent request another AT evaluation if they do not agree with the one done by the district. So I think I answered that. And that puts us at the end of our questions, unless someone else has a question that they have not asked.
We do have a few questions that were typed in the chat.
Oh, okay, thanks.
One was for Lucas. Does the trade team help with fitting and modifying the device and equipment to set it up for the family or the student?
I can, it's all depending on the needs and what I have available, at the trade center. If the family comes in with the child and needs certain specific modifications on the chair or piece of equipment, I can help out with that to adapt the I've done that for a couple different people. So yeah, I am able to do that limited to what I have available in the trade closet. I can do it here, or if the family wants to set up an appointment with the school or the therapist to go over what needs to be adapted, I can help with that. My exactly what needs to be adapted, they would have to come to the table with some kind of idea on what they need, because I don't do like the specific evaluations for, like I wouldn't have a specific evaluation for the student or anything like that. So like I said before, I'm more, I'm able to do that in a limited capacity. So yeah.
Great. We have another one that they wanted to know if you could speak specifically to AT for students with dyslexia and dysgraphia from elementary school through the high school years.
I can chat about that. Reva, do you want to chat about it at all, or you could? So just asking, in terms of dyslexia or dysgraphia, really work with your school districts to make sure that you get those particular systems in place. I know that's a real battle sometimes. I know there's a lot of confidentiality issues with other students and recording. So my best advice is, for example, there was one question I came in with a dragon pen, and the dragon pen can take notes, but it records everything. Is if there's a way for that student to get the notes on the paper in-house and erase everything before they leave school, confidentiality shouldn't be an issue. So there's iPads, iPhones are truly all accessible to individuals with reading and writing needs. So work with, there might be an AT specialist in your school, or your speech language pathologist might have also some ideas of how that works, and just finding that specialist in your school system, because it definitely can help. And even our phones that we hold every day are an accessibility feature. The confidentiality issue is something that has to be worked on and around, but it can work, it can happen. I hope that helps. If it didn't answer enough, please feel free to email me and we can chat more.
And I would say contact your school's occupational therapist. I mean, they should be competent in what is the technology specifically for, especially for high frequency disabilities like dyslexia and dysgraphia.
Yeah, and I just, just thinking about the student's future, it's really important. In our office, we work with quite a number of students in the higher ed setting who did not get these assistive devices in high school, and it is a battle, to say the least. to get them in a higher ed setting if they are not at least documented as being considered at some point in high school.
Can anyone describe any AT options that support executive functioning?
If we're looking at executive functioning skills, any type of scheduling is available. I know there's scheduling apps that you can use. So there is some high tech. There's also low tech, just building a communication board using any type of maybe personal photographs or board maker pictures. So executive functioning is really can be like your low basic, our calendars, any papers, or it can be high tech as well for executive functioning skills, which I think that a lot of our students, particularly after COVID, to be honest with you, even our quote unquote, our typical kiddos really need help with executive functioning skills. As a parent of a child who had difficulty with executive functioning skills, I know how difficult it is to learn when you don't have those skills in place. So low tech to high tech, and there's a lot of apps that can be available for free to help with that. Any other ideas, Reva, as well, or Christy?
I think, there's so many wonderful apps, and I love the phone apps, because every kid is on their phone all the time anyway. So, if you can use your phone in a way that, just seems cool, and you don't, you don't seem like you're standing out, because that's when kids don't use their devices, I find, when it's socially a little awkward.
Personally, in the trade center, I have seen an uptick in mid-tech, like the Quick Talker and the other devices for kids that the iPad is just too much for them. And a lot of the times it's the spacing. There is key guards for the iPads. That I do have a couple of those. For them to be specifically mistouching or touching wrong buttons and stuff. But definitely, the iPads do get requested a lot, but I have absolutely seen an uptick, which would surprise me, in requests for mid-tech devices for the younger kids. I think as a process to get to the high tech, just with that the buttons being separated more and just being not so much.
And actually, it's a good idea to start with low tech and mid tech before going to high tech. There's a nice process to follow. So that's actually good news, Lucas. I think that's good.
All right, I think that takes care of all our questions, and we're ending on time, which is fantastic. And we appreciate the questions. As I put in the chat, please complete the evaluations. We try to put a lot of time and effort to make these accessible and helpful to a wide range of folks, all those stakeholders we talked about. And so just taking a few minutes on your part to give us feedback is really, really helpful. So please do that. Once again, the next Lunch and Learn will be on restraint and timeout rooms and the changes to regulations, many of which are very positive. That'll be on February 14th, Valentine's Day, from noon to 1:30, and we'll be sending out information through social media and email and all the ways that you guys were contacted. And if you registered for this as well. And please share that and plan on participating. We will be posting this recording on our YouTube channel. I think Nancy put that in the chat as well. And sending out that resource page, which I wasn't able to get together for you right now, but I promise it'll be out in the next 24 hours. So, but most of all, I really want to thank the Southern Tier Special Ed Task Force and Sue Ruff in particular for putting together this panel for us. And then also, of course, Tina Caswell, Reva Reed, Lucas Stone, and Christina Asby for sharing a wealth of knowledge in a short period of time. This has been super helpful, and thank you for the responsiveness to the questions and the volume and quality of resources that are going to be on that resource page. So thank you so much. And I hope
Thanks for having me. Thank you.